Pleomorphic adenoma. The epidemiology. The pleomorphic adenoma is the most common tumor of the salivary gland. It is the most common benign salivary gland. Most common affect the site is parotid gland. Parotid gland is the largest salivary gland located in the front of the ear. Is the site of most frequently involved. Around 80 to 85 of pleomorphic adenoma arise in a parotid gland. Represent about 60% of parotid tumor. Is a all tumor that occur in a parotid gland is about 60% are the pleomorphic adenoma. Age group is a 30 to 60 years. Children is uncommon. This is a histological slide. You can see capsule is a well encapsulated tumor, and there is a grayish white structure is so arrow you can see chondromaxoid stroma. Microscopic features of pleomorphic adenoma. Tumor is usually well circumscribed, encapsulated, especially in the parotid gland. However, the capsule may be thin or incomplete. Microscopic extension can produce through. This is why recurrence can occur if excision is incomplete. Chondromaxoid stroma is a hallmark features of pleomorphic adenoma. The chondroid, cartilage-like, and maxoid is mucoid-like material. So called is chondromaxoid stroma. So this stroma is produced by the myoepithelial cell. The epithelial cell, tumor epithelial cell can form ductal, tubal, nest, and coat. These are mixed with the myoepithelial cell, giving the tumor its characteristic biphasic tumor. Triphasic. This is a triphasic tumor, ductal cell, inner lining by epithelial cell, and outer lining by myoepithelial cell. This is a chondromaxoid stroma. Chondromaxoid stroma. The stroma is a chondroid and maxoid. The myoepithelial cell, outer layer of tubules and scattered cell is in stroma. Lining of tubules and cord is a epithelial cell. Complete microscopic well circumscribed encapsulated tumor, biphasic tumor, consists of epithelial, myoepithelial cell. Epithelial component forms ducts, tubules, cords, and necks. Myoepithelial cell may appear in spindle shape, plasmacytoid, clear, and stellate cell. Abundant chondromaxoid stroma. The most characteristic features of pleomorphic adenoma: cartilage and hyaline or even bone formation may occasionally be present. Mild nuclear pleomorphism may be seen, but mitosis are rare. This is a fine needle aspiration cytology smear of pleomorphic adenoma. Dark purple cohesive cluster is a epithelial and myoepithelial cell. This is a dark purple cohesive structure. There is this blue color is a epithelial cell, and this is a myoepithelial cell, also called the plasmacytoid cell. This is a plasmacytoid cell. Plasmacytoid cell is a eccentric nucleus eosinophilic cytoplasm. This is also plasmacytoid cell. Pink fibrillary material between the cluster is chondromaxoid stroma. This is all chondromaxoid stroma, pink fibrillary structure. Scattered plasmacytic cell is a myoepithelial cell. This is all myoepithelial cell, scattered cell. This is scattered myoepithelial cell. Epithelial cell cluster seen in cohesive 6 and cluster of ductal epithelial cell. Cell are a small, uniform, round to oval with a bland nuclei. Nuclear atypia and mitosis are absent. The myoepithelial cell are singly and scattered. Plasmacytoid eccentric nuclei with abundant cytoplasm. Spindle-shaped stellate cell. This cell produce the characteristic stroma. Chondromaxoids, maxoid and matrix. Chondromaxoid matrix. This is apparent pink magenta fibrillary metachromatic material in the background. This is the most common characteristic cytology features of pleomorphic adenoma. Background clean, background abundant marxoid chondroid material. Necrosis absent. Necrosis absent in this uh, smear. This is also smear of pleomorphic adenoma. We can see lot of myoepithelial cell, also called plasmacytoid cell. This plasmacytoid cell secrete the chondromyxoid stroma. We can see pink color chondromyxoid stroma and blue color is a epithelial cell. This is a plasma myoepithelial cell. Hallmark features of pleomorphic adenoma: large round oval cell with eccentric nucleus, abundant eosinophilic pink cytoplasm. They resemble the plasma, so they are called plasmacytoid myoepithelial cell. These cells are a characteristic feature of pleomorphic adenoma. Mixochondroids, chondromyxoid stroma, pink fibrillary metachromatic background represent the myxoid or chondromyxoid matrix. The matrix is secreted by the myoepithelial cell and is the key diagnostic features of pleomorphic adenoma. Epithelial cell, small cohesive dark purple cluster of uniform epithelial cell are seen in especially in a lower left corner. This is also a smear of pleomorphic adenoma. We can see fibrillary stroma like thread and epithelial cell merge into the chondromyxoid myoepithelial cell merge into chondromyxoid stroma, and this is myoepithelial cell merge into chondromyxoid stroma. The fibrillary stroma, bright pink for the feathery fibrillary material around the tumor cell, chondromyxoid stroma. It has a fibrillary thread-like appearance on a cytology. Matrix is produced by myoepithelial cell. This is one most characteristic cytological features of pleomorphic adenoma. Other features in dark purple cell embedded with the stroma are myoepithelial cell. This is a myoepithelial cell. This cell may plasmacytoid spindle shaped or oval. Nuclear uniform band and no significant atypia. This is a myoepithelial cell. Eccentric nuclei. Eosinophilic cytoplasm. So let's finish. This is all smear of smear of pleomorphic adenoma. You can see lots of epithelial cell, and you can also see myoepithelial cell, eccentric nuclei, eosinophilic cytoplasm, and this slide also you can see all chondromyxoid stroma, and this all myoepithelial cell merge into chondromyxoid stroma. This is all mark of pleomorphic adenoma. The treatment for pleomorphic adenoma, if superficial lobe is affected, we can remove pleomorphic adenoma. We can remove superficial lobe. If deep lobe is involved, we can we have to remove parotid gland for preservation of facial nerve. If simple enucleation is why simple enucleation is not recommended, because if we can in this simple enucleation remain of capsule or tumor tissue or small stellate nodule of tumor. May this tissue capsule or nodules may grow into pleomorphic adenoma, means recurrence occur. Recurrence rate approximately 2 to 5%, because a tumor removed within the normal tissue. If simple enucleation done, recurrence rate is 20 to 25%, because incomplete capsule removal, pseudopodia extension, means some tumor tissue may extend beyond the capsule and remain in the tumor sites, and tumor spillage during the surgery led to recurrence of pleomorphic adenoma in 20 to 25% of the patient. Thank you.